Hello students, in today's session I will discuss some question answers which are basically related with the pharyngeal arch defects. So here the first question is that a 10-year-old girl present with a smooth round neck mass of a size of the golf ball at the upper third of anterior border of her right sternocleidomastoid muscle. Now my dear students, in these first three lines, the important key word is anterior border of sternocleidomastoid. That means you are dealing with something in front of sternocleidomastoid in anterior triangle, not in the posterior triangle. Now the swelling is very smooth. Now another important thing is that her mother says this was a small peanut size mass and it grows without pain. So there is no pain or inflammation, and after it become noticeable 2 months previously. The mass does not affect the girl's daily activity, and which is the most likely diagnosis by seeing this picture. So my dear students, when you will see this picture, this is your sternocleidomastoid and here you can see that this is the mass. Now when you will see the four options, thyroglossal cyst. Now thyroglossal cyst always a midline problem, and it occurs when you have the diverticulum which is going downward in the midline to form the thyroid gland. So it is not a midline structure, so it cannot be the thyroglossal cyst. Then you have undescendant thymus. Again the undescendant thymus is a midline structure, so it cannot be the answer. Then you will have preauricular cyst and ectopic palatine tonsil. Now my dear students, when you will have preauricular cyst, now these preauricular cysts are always and always related with the external ear defects. But in this diagram you can see the external ear is purely normal, it is not having any defect, so it cannot be the answer. Now when we are talking about ectopic palatine tonsil, the ectopic palatine tonsils, if present, they are present inside the oral cavity in different part of the pharyngeal wall. They are not the external appearance. So this cannot be the answer. So your answer is branchial cyst. Now when you will see the branchial cyst, you know that branchial cyst develops as a remnants of the cervical sinus, and the most common site of branchial cyst is below the angle of mandible. So here you can see that it is written here, there is a mass and this mass is present in the upper part of the neck, and the most common site of the branchial cyst is along the anterior border of sternocleidomastoid. So whenever we are talking about the branchial cyst, they are always present in front of the sternocleidomastoid, and the most common site is near the angle of mandible. And what is the cause of branchial cyst? Answer is they are remnants of cervical sinus. Now the next question is, a 25-year-old woman pictured asymmetry in her neck when she tensed the skin of her inferior face and the neck. That means when you ask the patient to pull this platysma like this. Now when you are pulling the platysma, you are having the formation of the fold on both the side of the neck. Now here when this patient is pulling her platysma, this fold is produced on this side, but this side of the neck is smooth. This asymmetry may be due to the limited mesodermal migration. Now what is the embryological structure which is responsible for this problem? Now you know that we are talking about a muscle, and that is your platysma. Now this platysma which is producing the wrinkles in your neck is a muscle supplied by facial nerve, and you know that facial nerve is a nerve of second arch. So clear cut, the answer is second pharyngeal arch defect. So when there is a mesodermal migration of the second pharyngeal arch defect is there is a lack in the development of platysma in this region, and that's why this patient is not able to produce the wrinkle. Now at the end of this session, you are having some idea about the applied questions which are related with the pharyngeal arches. Thank you.